I also want to talk about the consequences of when there's a lack of clarity about what happens when our laws mix up material, concrete, and physical realities with words and claims about identity. And the reason I want to do that is because the consequences can be horrific. When legislators make mistakes, it's ordinary people who suffer, and our laws have to be clear, and in situations where sex matters, it's sex that matters. People can identify however they like, as long as claims about their identity don't injure other people. But injuring other people is what's happening now, because our laws have drifted away from reality, and in the process have got muddled. And it's well past time to return to clarity and reality, and doing that means clarifying that when the Equality Act says sex, it really means sex. We're at a juncture where we've got to draw a line in the sand of competing claims. I ask my honourable colleagues to think of a stark but perfectly commonplace example of a situation where sex matters, that of a woman who is having a gynecological procedure. Perhaps she's having a cervical smear test, or she needs a hysterectomy in which a camera is passed through her vagina and cervix into her uterus. And for such procedures, she must take her clothes off from the waist down and be touched intimately. And many, many women are unwilling to go through such procedures except with female health workers. Some women have specific reasons. They're survivors of sexual assaults, or their religion requires them to avoid intimate contact with any man except their husband. Others are simply setting their own boundaries on the basis of what's comfortable for them, and their feelings for privacy and dignity are perfectly normal and a perfectly sound basis for them to grant or withhold consent. So here's the stark question in clear language. Is a man who identifies as a woman a satisfactory person to provide care to this female patient who has stated that she is willing to undergo such a procedure only at the hands of another woman? And here's what the NHS Confederation said in guidance sent to the country last week. Despite the express wishes of the patient, that man is a suitable person to provide care to that woman. His feelings about his identity override the material reality of intimate contact with her body. They override her privacy, her dignity, her boundaries, and her consent. And if she complains, she's transphobic, and she may be asked to leave the hospital or surgery. And if her relatives speak up for her, they may be removed. All of that's dressed up in the language of gender identity. The patient has no right to know the health worker's gender identity. But it isn't the identity of this man the woman's concerned about, it's his sex. The NHS Confederation is not an outlier. The British Medical Association, which regulates doctors, says that patients have no right to be told a healthcare worker's assigned sex at birth. However, there isn't a sex assigned at birth. There is the only sex observed at birth determined by conception. And moreover, if a patient has asked for a carer of the same sex as them, according to the BMA, it's the comfort of the staff member that should be prioritised.